medical care until you prescribe something. And I think it's very hard for us to not do something, right? We just want to do things, put a needle in, put a scalpel, put a tube in, write a prescription, give a referral. But in fact, that again is ancillary. I think we have to appreciate that that's not the essence of the medical care, that we can make the diagnosis, 80% of the time with nothing but the conversation and physical exam. We can also administer the treatment a lot of times by how we talk, because a lot of things relate to lifestyle, right? What we eat, how we exercise. And then you pick the one test or the one prescription you need carefully. We're so used to doing things, and I think that mindset gets us to a lot of over-treatment, over-diagnosis. But thank you very much. One more question, and I'll, yes?
So you mentioned when you were reading about the gentleman in the tracksuit, his name I forgot. Thank you, Mr. Hamidi. That you recognize that he had tremendous fear, and that resonated with you. But I'm curious if as a doctor, if I was a patient, I said to you, look, I know this doesn't seem like a big deal, but I'm really scared. This is it's very painful for me, and I have a lot of fear about this, and when it happens, I don't know what to do. Is that, or should you just be more clinical? Should you leave the emotion out of it?
I think it's very important because what scares a patient is important. So let's just say a patient's come in with their little finger hurts. And all I look at and say, it's nothing. But if they think that's cancer and they're going to die, I don't address that fear. They are not going to be able to sleep or rest. I'll tell you one story of a patient, a young woman came in with a scalp condition. I looked at it, it's basically fungal infection, here's the cream you need. And then she also has these aches and pains and these sort of various spots. She's totally young and healthy. There's nothing on exam. There's no illness I can find to link them. I say, it's the aches and pains of life and you're healthy. And I say goodbye and she walks out and I'm writing. And she's standing in the hallway with her hands still on the doorknob and she says, Doctor, do you think maybe these spots hurt because that's where my boyfriend shot me with a dart gun? And I realized that I had missed domestic violence because I wasn't really listening or taking a careful enough history. And I would have been just one of, millions of doctors who missed domestic violence and depression and suicidality and all these other eating disorders and sexual abuse and elder abuse. The patients wouldn't necessarily come and talk to you about. And had she not been courageous enough to hang on to that doorknob, I would have missed it too. And so, yes, maybe these look like nothing to me, but I need to ask and listen hard because often something else is the underlying agenda. And so if it isn't that you're afraid of, that's important to know because we can't settle the issue of your, hurting pinky until we know what the real fears are. Last question for Mary?
Yeah, I was actually just going to make a comment. So my daughter missed 3 years of middle school with a mystery diagnosis or a mystery problem. And I'm relating to so much of what you're saying here, particularly as it impacted her. She was dismissed again and again. It's all in your head, you're making this up, it's just growing pains. By the time we got to the Mayo Clinic and got a diagnosis that has transformed her life, one of the tools that was critical for us was creating a medical summary. Instead of telling the story again and again to so many doctors, we had it on a piece of paper and could hand it to the doctor. And it seemed to be an important tool in getting to the next step. So I'm sharing that. I love the narrative, and you're wonderful. This is just incredible. I'm so moved as someone who's
I
got
just want to introduce Mary Silver, a fellow PS 116 president who's running for city council in our district. I just want to
thank you so much, but thank you. I appreciate it. But I do want to say that personal narrative, one page, no more than that.
I was going to say succinct, because I do the patient who walk in with a tome and say, well, here's my chart, so you just read that, and I'm like, next year, do you want me to get back to you? So being succinct is very helpful. I just want to end by thanking Brotherhood and the Jewish Board of Family Services, the Chesed Committee, Rabbi Alder, and Cantor Mike, and the committee for having me here. It's really a pleasure to be in home territory, and I'm happy to answer questions, sign books, and really have a wonderful day, guys.